Okay, so for today's demonstration, I'm going to be performing wound care on an abdominal wound. So just taking the old dressing off, irrigating with normal saline, packing and putting the new dressing on. So I would have looked over the MD's orders for the dressing change, so I know the reason for the dressing change, what supplies I need. I offered the patient analgesia beforehand. I would have performed hand hygiene, gather my supplies, perform hand hygiene again, enter the patient's room with a general survey and safety check, introduce myself and explain the procedure. So hi, my name is Sarah Kennedy, I'm a third-year student nurse from the University of Manitoba. I'm just here to perform your dressing change on your abdominal wound today. Is that okay? Good. And can you tell me your name and birthday? You just want to check that, make sure they're birthday that the same matches the name and birthday on the armband as well, which also should match what was written on the doctor's orders, or the name and birth date on the doctor's orders, just to make sure you have the correct patient. Okay, so today I'm going to be performing a dressing change, so just taking the old dressing off, irrigating with normal saline, and putting a new dressing on. Is that okay? Still okay to do? Okay, excellent. So I'm going to start setting out my sterile field. This table should be ideally at waist, or should be at waist height. It's a little low just because I don't have a table that's taller, but I cleaned it beforehand, so that surface is clean before I put this on. I'm going to perform hand hygiene, and then I'm going to start setting up my sterile field. Okay, so this is a little garbage can. I also have another garbage can on the ground there, but just being mindful of my 1-inch borders as I set up. So I'm not going to use the sterile drape, I'm just going to put that to the side. I'm not going to use my garbage bag either, just because I have a bunch set up already. I'm just going to put these to the side. Okay, so now I'm going to start adding to my sterile field. So I have these two 4x4s. So they've been opened a bunch, but you would ideally wing them back using the forceps. Putting that to the side. And again, these would normally not be opened already. Okay, so I have a 20 gauge Clathlon. It's been opened, so the packaging's a little hard right now, so I'm just going to drop it in, but normally it would be better to put it in with the forceps, but just because it's been opened so many times, I'm just going to drop this. Putting out my ruler, and that was a 20 gauge as well. So I have my 30 cc syringe here, winging it back, adding that gently to my sterile field. Adding the acrylic, so this would also normally be in sterile packaging, so it would be winged back as such. And again, this would be sterile packaging and not a Ziploc bag. So adding that. Okay, adding my cotton tip applicators. And then I have my sterile scissors here. So again, these would also not normally be opened, and I would bring that back. Just gently adding those to my sterile field. I like to prop them up. Okay, so now I'm going to add my normal saline. I just want to be very mindful not to get any drops outside the tray. And again, the table would normally be at waist height. I didn't get any drops outside the tray, so that's good. Okay, so now I'm going to be performing hand hygiene and taking the old dressing off. So just noting the color, so sanguinous, serosanguinous, serous drainage, the amount, so the percentage that's on the abdominal pad and the previous dressing, and then also any odors that are coming off. So I'm just going to take that off, and then putting that on there, and then taking the gauze out there. So again, I'm just noting the color, so you could say it's, let's say, serosanguinous, and the amount, the percentage, so let's say 30%, and any odors that are coming off. And I'm going to be doing more of an assessment after I clean it. So I'm going to be taking these gloves off and performing hand hygiene again. And at this point, I want to don my sterile gloves because I want to begin irrigating and cleaning the wound. I'm being very careful when I put these sterile gloves on. There we go. And then with that one here, and again, just be very careful when I put them on. Adjusting the fingers after. So I'm going to irrigate. I have a 30 gauge or 30 cc syringe here. I want to irrigate. I'm going to, for the purpose of this video, with 10 cc's. I'm going to normally in real life irrigate until it, the drainage runs clear. I'm just going to be using 10 cc's for the purpose of the video, going from cleanest to dirtiest, so more of the center to the outside. Yeah, and then I don't want to also I don't want to get any of the normal saline onto the peri wound so much, so I want to stay within the wound bed just because I don't want to bring any more contaminants inwards. So just being mindful to draw. I'm drawing up my 10 cc's of the normal saline, and then I'm going to be adding the 20 gauge cath onto it, and from about 10 centimeters away. So just going from the center to the outsides. And then I'm not going to use the full 10 because it'll make a mess, but that's how you would clean it. So from the center to the dirty, I made sure not to get any of the peri wound or go outside to the peri wound because I didn't want to bring any contaminants inward. So now I need to dry. So I'm going to be using two 4x4s just to sop up the normal saline, and I want to make sure that when I let it sit, I'm not letting the saline come and run up to my gloves because I don't want to contaminate my gloves. So I'm just letting it be very gentle there, and then there, and then we're going to use one more just because there is a bit left. I want it about as moist as an eyeball. There. So that's all good. So now we're going to start cleaning our peri wound. So I'm going to make little rosettes. Okay, so dabbing that with the saline. We're going to do one swipe per wipe from the cleanest to the dirtiest. So the head's on that closer to my right. So one swipe per wipe, cleanest to dirtiest. So going from the top downwards, one swipe per wipe, and then disposing of that. And then we're going to make a rosette to clean the other side. Dabbing that with the saline there. And one swipe per wipe to clean the other side. And then we're just going to dry the peri wound. And one swipe per wipe for the drying as well. One swipe per wipe. And then drying again. And it's okay. And it's important to assess the one swipe per wipe. It's important to assess the wound now that it's all cleaned. So I'm going to be assessing for any signs of healing, the condition of it. I don't see any obvious tunneling or undermining, so I'm not going to poke and prod for that. But I do want to note the measurements of the wound. I do see some granulation tissue. Okay, so that's there. And then I'm going to be noting the length. So that's about 13 centimeters with the width. So that's about 3 centimeters. And then the depth, which is about 2.5 centimeters, disposing of that. So now I'm going to start packing. Because we've done our wound assessment, we know the measurements. We're going to start packing our wound now. So I'm using the Acrylics here. It's saturated in the normal saline, so I'm just going to wring it out and be very mindful because I don't want to get any drops outside. Okay, so we haven't gotten any drops outside, which is great. So I'm going to be using the Q-tip to pack. And I'm preparing it here. So I just want to, I don't want to pack it too tightly, and I don't want to go outside the wound. I don't want to go further than maybe 1 or 2 inches from the peri wound, but ideally not at all. And yeah, we're not packing too tightly because we want to promote healing. And we don't want to go above the surface of the wound either. Okay, so I'm disposing of that. I'm going to grab my sterile scissors. Okay, so putting that there, that can be disposed of as well. I just want to make some minor adjustments just to make sure that's nice and packed. Good. Okay, so disposing of that, and I'm going to be using my forceps to apply the 2 4x4. Okay, and then I'm going to be putting on my abdominal pad here. Okay, taking that off. And it's important to note that once I had my scissors down, I was no longer sterile, which is why I always didn't directly touch my tray, and I used the forceps when putting on the 4x4s. And so just applying the medical adhesive tape to the 4 sides. And so I'm going to be showing you the packing. So that would be our finished wound. I'm going to show you the packing just because it's a bit easier to show afterwards. So I'll just grab my phone here. So again, we want to make sure we weren't going over the surface and that all wound surfaces are covered.